Good morning, everyone. It's Dr. Herzog, and I'm really excited that today is our second vlog. We're going to be putting this out every single week, so I hope you enjoy it. Today's vlog, I'm going to bring you through my day just like I did in the first one, but I'm going to show you a little bit of everything as far as the process of placing an implant and restoring an implant goes. So I looked at the schedule today and I told my videographer, you know what, we have everything on the schedule today for our patients and our doctors to see exactly what we do here. So I'm excited to show you the process, and we're going to start off by showing you how we place an implant, and then the process of uncovering an implant, the process of scanning and delivering a crown, and then actually checking up on that crown 6 months later, and all of the important things that I look for during each of these steps you'll be able to see and gain some insight from. So I hope you enjoyed today. We have a lot going on. We have a ton of patients. We have lots of surgeries, but I will take you through step by step on each one of these procedures so you can understand. And so when the tooth comes out, it's really important the doctor cleans everything. In this case, she really doesn't have much buccal bone, so we'll have to rebuild that. And clean out that ligament and all the infection that could have possibly been in there. Although it didn't look infected. So this is the bone graft material. Comes in a kind of like a powdered form. We mix it with saline, sterile saline. And this is placed into the socket. And so we just put a little bit at a time and we condense it down into the area. And this is going to prevent the tissue from coming into the area and creating a bony defect. And so this will prepare the site to then place the implant in 3 or 4 months. You can see it's really simple to place a bone graft. In some cases, like this. And then this will not guarantee, but most likely our foundation will be ready to receive the implant in 3 to 4 months. Once the bone graft is placed, a collagen membrane is placed over the top of the bone graft, and that prevents the gums from growing into the bone graft. Then here I do place the dissolvable sutures, which is the gut sutures, because this area is already inflamed and these sutures are going to fall out in a couple of days, which is all I need for really that blood clot to set up and protect the bone graft from coming out. So I just need a couple of days of this suture to protect my bone graft. In this case, there are different types of bone grafts that require a little bit more of an advanced technique, but this is a general socket preservation bone graft. And this is something that every general dentist should know how to do. So if you don't know how to do this, I recommend you take a course, because this is something that you should be offering to every patient if you're doing extractions. I really believe that it's standard of care to at least offer a bone graft. If you don't know how to do it, then refer it out. And the collagen is just held in place with this little suture here, which will fall out in about 48 hours. And that's it. Ya terminaste. Ya tiene el injerto y todo. Ya tienes el injerto de hueso, ya le quité la raíz. Ya. Mañana te dan el provisional. Abre. That's an extraction and bone graft for you. So today we're gonna place an implant number 30 here, and I always like to wear a new gown and put a hat on, and there are several things that we do to make sure that we protect ourselves, and that's very important. and also to protect the patients. And so you'll notice that I dress up. I wear heels and I wear pants and shirts, and I don't wear scrubs. And I'm okay with that because I have this disposable gown protecting me and also protecting the patients. So some things about sterile technique or aseptic technique, hand washing is a big thing. And then of course, donning your gloves. And people think that I'm crazy because I go through so many gloves, but I change gloves every time I have to touch something. I'll take off my gloves and I'll open a box and I'll put new gloves on. And this is just a habit that I've formed. And unfortunately, we do go through lots of gloves, so it's not the best thing for the environment, but it's the best thing for the patient. Ready? So some doctors wear loupes, which are some magnifying glasses, which I do sometimes wear when I'm doing small restorative things, but not surgery. I like to have a greater field of view when I'm doing surgery, which is why I don't wear the loupes. So I just wear a disposable mask like this so that I don't get any blood on my face. So I've already given her a block, which means that I've blocked the nerve that gives the sensation to the gums and the area where I'm placing the implant. But I always like to put a little bit more anesthesia right on the ridge. ¿Me entiendes? And what that does, the hydrostatic pressure from the actual anesthesia lifts the gums. ¿Te duele aquí? No. It lifts the gums a little bit. So it makes raising my flap a lot easier. So I've already, in a sense, done that just with my anesthesia. And at the same time, I'm just double checking that the patient is anesthetized properly before we get started. I use a disposable blade, but a metal handle. I like the feeling of the metal handle better than the plastic ones. And then this disposable blade, I go through several of them. If I'm doing a surgery involving more than one incision, I go ahead and I change the blade every time so that I have a nice clean incision. And these are the little things that maybe patients don't realize that makes the surgery less painful later on. If your surgeon's using a dull blade, then you have to cut harder and you have to tear tissue and things like that. And this will make the recovery a bit harder. So sometimes people ask me, I don't understand. With so-and-so doctor, I had pain for a week, and with you, it's like nothing happened. It's the little things that count. It's really how you treat the tissue that will determine whether the patient has pain post-operatively. People ask me, how do you know how far you're drilling? Well, the drills have markings on them, and these actually have stoppers on them. I don't love the stoppers, but I do need the markings. So after I do my pilot drill, I always take a pin and take a look at the angulation. You can see that looks really good. Perfect. And then I'll continue on. I have a CT scan, so I know how far I'm supposed to be going. And we just go through the process of getting through the different size drills. And the patient doesn't feel anything except for vibration and water. And I make sure to pump the drill so we get lots of saline in there to cool off the bone. So now this is called the implant driver, and this engages into the implant here. So the part that has the spiral light gray is the implant itself. So when you're placing the implant, you actually want some blood in there. And this is going to coat the implant and allow for greater healing. The only way you heal is with blood, so we want to make sure we have some good blood supply in there. And bring the implant down almost to the last thread. And that's where it should stop. And then we'll go ahead and hand torque it down a few more. If your implant hasn't is 5 or 6 threads up still, and you've already hit 35 Newton centimeter of torque, you need to back it up and drill a little bit more. And in this case, you want to keep the platform of the implant about 1/2 millimeter subcrestal. That means below the bone. Driver. This is a screwdriver or a hex driver. And there's the cover screw. Okay, so now she has her implant. ¿Ya tiene su implante?
Yeah.
Ya. Le voy a poner unas suturas. So that's it. That's the whole process of placing the implant from A to Z. We're going to place Vicryl suture now. I use Vicryl suture because it doesn't cause an inflammatory response, and I don't want any inflammation over my implant. I don't mind using gut sutures for an extraction and things like that, but I really don't want the chromic gut over my implant. To us what you're doing. This is very important. He's videoing.
Oh, wow.
You don't need a mask to make coffee.
Okay, I don't need a mask to make coffee, but I need mix the sugar with a little, with the first drop of the coffee. And when I mix it, I make it look like
Foam.
a foam. And that's it. Easier.
That's Cuban coffee.
Coffee, strong Cuban coffee.
If you don't get the first drop and mix it with all this sugar, then you don't get the foam on top, which we say espumita in Spanish. And here at Implant Center of Miami, we love our Cuban coffee. Okay, so we're going to take a 4 millimeter tissue punch. I usually like to cut them so they fit in the mouth and the posterior. And just go right over the implant with the tissue punch. Okay? ¿Estás bien? The implant now, but it's basically just uncovered right at the tippity top of the implant. Driver, please. So the incision is really tiny, there's not a lot of bleeding. And there's the cover screw, just like when we placed the implant earlier. This is chlorhexidine. I like to irrigate the area. And we're going to place something called the healing abutment now. And that typically will stay in the mouth for 2 weeks until the gums heal around it. And then we scan and make the tooth. But he's going to Cuba next week. So we're going to scan today, right? And make a fast tooth. So that's the healing abutment. And that just goes right here. And that is a very simple uncovering. That's it. Beautiful. Now we're going to do the other side. So here is the crown. You can see that the crown is attached to the abutment and there's a screw. Over here you have the hole, or the access hole. So this is how we know where the screw is, and then we'll seal this hole, and this is called a screw retained crown, and we make these here in the office. I'm gonna go ahead and deliver it if you want to see. So then the crown will fit just right into the space where the implant is, and the patient's gonna feel a lot of pressure when I'm screwing it down. Va a sentir mucha presión, okay? So you can see that now the crown has been just screwed on. You see this? And basically we've just replaced his tooth with a permanent tooth that we can floss through, he can chew with. It's very strong, it could hold more than 450 pounds of pressure. So that's a lot of force, like an alligator. Once we place the crown, like I just did, I just hand tightened it, and we'll get an x-ray just to be sure that it's perfectly seated in the implant itself. I checked with floss to make sure the contacts are okay. And then once we get that x-ray, then we'll seal that access hole and adjust the bite. Okay, so you've had your implant now for 6 months or more. You feel like it's yours, you're chewing everything. You don't even know that it's a fake tooth. Well, your doctor wants to see you in 6 months for a checkup. What are they gonna look for? Why am I going in? I don't feel any pain, I don't feel any discomfort, it's chewing just fine. You know, it's not loose, I'm not packing food. So what happens is implants, they don't move. But your other teeth, they do, they shift. And so if all of a sudden, all your other teeth start shifting because you're stressed and you're grinding your teeth, or you created a new habit of biting your nails, or just with age, your teeth are shifting, but your implant stays in place, now the implant could end up being high and all the other teeth low, which makes all the forces hit the implant first. And that can cause bone loss and destruction of the bone around the implant, causing you to lose the implant. So it's important that you get a checkup so the doctor can check your bite, as well as take x-rays to see if there's any bone loss, make sure there's nothing loose, and make sure that the contacts are still tight. Some patients come in 6 months later, and even though the contacts between their teeth were nice and tight, now they have a big gap between the implant and the tooth behind it. It's usually the last molar. The last molar has started to drift back, creating this huge space where food just gets trapped and trapped and trapped, and now they get a big cavity. And so in those patients, I do redo their crown for them if it hasn't been too long, but I require that they get a retainer. It's the end of the day, and we have done several procedures today. I'm actually getting to leave kind of early, which is awesome. But basically, I brought you through the whole process aside from the initial consult. So after your initial consult, when we placed the implant, you saw exactly how I placed the implant, how quick the process is, what I do, the techniques that I use, how I keep everything sterile and clean, how I protect the patient and myself. You saw then after the healing process, how to uncover those implants, the simple technique that I use. I try to make everything very straightforward. I follow my own protocol every time, and I don't try to veer off that. And so that was the uncovering portion. And then after the uncovering, you saw how we scanned the patient and delivered a crown. And so you saw how simple it was and what type of crowns that I like to deliver, which are the screw retained, if they're possible. And then you saw 6 months later the checkup on the crown and how important that visit is. If you don't check up on your implant crowns, then you may never know if you have those forces hitting upon them like this patient did, and you can actually lose an implant. And so I really brought you full circle the whole process of from placing an implant to restoring the implant to the checkup 6 months later and so forth. So I hope you enjoyed this video. This is Dr. Herzog. This is Implant Center Miami. I'm gonna keep doing these vlogs for you. Subscribe, like, share, all that good stuff. And I will see you soon. Double hatting.